When and how can you treat a burn at home, and when do you need to get to a hospital? Today I'm going to talk about 3 different types of burns, how to treat them, and when it's absolutely necessary to get to that hospital.
My name is Angeline. I'm a wilderness first responder, an EMT, and a mom. I'm here to help you confidently manage your family's health issues and emergencies, and maybe even save you a little money.
Let's start out today's video with a story time. Once upon a time, a really cool family, mine, went camping in Yosemite National Park. As evening rolled around, we started a campfire. The children were playing all around the trees and playing hide and seek behind the trees and running and laughing. And as one might expect, the smallest child fell with his hand right in the ashes, right in the coals of the fire, and he got a severe burn on his hand. This was long before I had embarked on my medical education journey, and one of the events that actually prompted me to start learning wilderness medicine was how to protect my own children in the wilderness. So he was hurt. There was a lot of very loud crying and very little that we could do about it other than to just try to cool off his hand and comfort him, being as we were 8,000 feet up and it was night and there was no medical center available. So how do we deal with this? What do you do if you're in a situation like this? How do you take care of the burns? Well, this is what I'm going to help you know how to do. And the very first thing you need to know about treating a burn is you need to be able to know how severe is it. So there are 3 different types of burn. We've all been at the first degree burn place, I think, with a nice juicy sunburn. True story, my husband decided to put his own sunscreen on one time, and I don't know what he was thinking, but he got sunscreen all on his palm of his hand, and he kind of touched his back with the palm of his hand without even really smoothing it around. And he got this terrible sunburn in the shape of his hand, and he'll probably never live that one down. So that's a first degree burn, when it's just a redness on the outside of the body. You don't have any blistering or any broken skin. It's just burned on the surface. Second degree burn, you've burned deeper, and it looks kind of like this, where you've got some blistering going on. You can see that the deeper structures are this top structure is definitely damaged, and it's gone deeper than that. Third degree burn is when it's even gone past the blistering stage. It's all the way down to lower structures. It could be as deep as fatty layers. It could be as deep as muscle. It could be as deep as bones. That's your third degree severe full thickness burn. It might not even hurt. It's that deep. It's gone past the nerve. The nerves are so damaged that you don't even maybe feel it. So it's really important to know how severe a burn is, because your skin is the largest organ on your body, and it has 2 main functions. The first one is to protect the outside germs from getting inside your body. That skin is a nice protective barrier for all of your organs and your blood and your bones and all the things that need to stay nice and clean to do the jobs that they do. Also, it thermoregulates. It keeps you the right temperature. Your body can sweat. Your body can warm up if it needs to, because if it's chilly outside. So your skin has it's like I said, the biggest organ on your body, and it has really important jobs. If it's damaged, a lot of other things can go wrong on the inside of your body. So we got to take care of the skin. You need to know when you must go to the hospital. First and foremost, before I get into how to treat burns, you need to know when you can't treat this burn. You've just got to get to a hospital because it's unmanageable. First thing is if it's a burn that affects the breathing system, burns in the mouth, burns in the throat, burns that go all the way down to the chest, like maybe a blast of heat has come, you've inhaled and you've burned those structures, to the hospital. A burn that includes broken or fractured bones, to the hospital. It's too complex. Get to the hospital. Burns that go all the way around a limb, like imagine a burn that goes all the way around the arm like a bracelet. That can cause a problem because there are parts of the limb that go, that are furthest from the body and parts that are closest from the body. And when that burn of the skin is surrounding that limb, the circulation isn't moving back and forth like it needs to. So, to the hospital. Burns that are on the hands, feet, face, or genitalia. It doesn't even have to be a full thickness burn. Even a second-degree burn with the blistering, these parts of your body are so functional that you can't live without them. You need to get to a hospital, need to be dealt with right away. Burns on or in the eyes. Probably goes without saying why you would need to get to a hospital for that, but eyes are very delicate, to the hospital. Moderate burns on under 5 or over 55 aged people. And that would mean, the reason is because these are more at-risk populations. The people at these age categories may need additional help to heal from the burns. And if you're not healing burns, you may be getting infections. So healing must occur. And we want to make sure that the healing can happen. So to the hospital. Deep burns or even moderate burns on 10% or more of the body. Remember, I said that the skin is the largest organ on your body, and if 10% of it isn't functioning, that is a huge percentage. To the hospital. How do you know if 10% of the body has been covered with burns? Well, there's this thing that we call in the medical community the rule of nines. I don't think that you need to remember the rule of nines, although if it helps you, go ahead. But basically, you can kind of imagine it just by segmenting the body. So look at the adult graphic on the left here. 9%, the head's worth 9%, an arm's worth 9%. The top of the chest is worth 9%, the stomach is worth 9%, the top of the back is worth 9%, the bottom of the back is worth 9%, the top of the leg's worth 9%, the bottom of the leg's worth 9%, both front and back. Genitalia is worth 1%. Babies, on the other hand, are a little different because their heads are so big. So their head is not worth 9%, their head is worth double that, 18%. So without having to memorize the rule of nines, just figure out, is the area of the body that's been burned the size of one of the segments of the body? Arm, upper leg, lower leg, front, back, chest, the things I just listed. Is that big of a surface area covered with burns? If yes, to the hospital. So when do you at least need to go to a doctor? Third-degree burns that appear leathery, charred, pearl gray, and dry. And also, if you've treated a burn and it isn't healing within 2 weeks, why do you need to go to the doctor in these situations? So the burn above is called a third-degree burn. Third-degree burns are such a deep burn that your skin is no longer protecting your insides from your outsides. You're dealing with a potential systemic infection if any germs go through that hole in the skin that's been created by the burn. So what the doctor can do is, first of all, use sterile tools to remove any kind of loose flaps of skin that have been burned, so that it doesn't create little pockets where bacteria can hide. A doctor will also give you oral antibiotics. You might be in a situation where you live in the wilderness and you keep a store of antibiotics for yourself and for your family, and if you know how to use that, a third-degree burn would be the time for that, for sure. And also make sure to cut away all those dead flaps of skin, because they are little breeding grounds for bacteria. So how do you treat a burn that isn't one of those situations where you need to go to the hospital? The very first thing you do is remove any clothing and jewelry. if you have a burn, there's probably going to be some swelling, and you want to remove the jewelry, because if there's swelling, the jewelry can get caught on a finger or a wrist and cause a constriction with that swelling, and then you've got a circulation problem. You don't want two problems. Take off the jewelry. Also take off the clothing for the same reason, but also because the clothing is probably dirty. You don't want to introduce new bacteria. Okay, so your regular sunburn. Basically, stop the burn with cool water, not ice. You put ice on a burn, you can actually damage the skin even more, because it's not only been damaged by heat, but now you're damaging it with cold. That's a whole other problem. That would be like frostbite. Don't do ice. Cool water. If it's a serious situation, I've heard of people, jumping into a swimming pool. You can jump into the river, whatever big body of water to cool off if you've got a huge, a burn all over your body. But in any case, cool water. And then apply a cooling gel or cream to the skin, keeping it moist. Keeping it moist is very important for healing a sunburn. That's why people put aloe vera gel. You can put burn gel. Even maybe petroleum jelly if you must. If that's all you have, that would be fine. But basically, keeping it cool and keeping the skin moist and protected from the sun so you don't get burned more. And then, of course, you can take painkillers, ibuprofen or Tylenol. It's pretty much all you can do for a superficial burn, a first-degree burn, a sunburn like that. My tip is keep some burn gel, which you can buy at the drugstore. Keep it in your first aid kit. Or if you can get it from a doctor, Silvadene. Silvadene is, in my opinion, the gold standard. It's made with silver in it, and it has painkiller properties in it, and it's especially made to protect and soothe burns. Second-degree burns are when you have damaged that upper structure. It's not just redness on the outside of the body. You've actually damaged that whole upper structure of the skin, and it's gone deeper. It can look blistery. You can definitely see damage to the skin. It doesn't look right. So treatment would be, first, stop the burn with cool water. Again, not ice. The skin's already damaged. You don't want to do a whole other kind of damage to it, but you do want to cool it down so it doesn't keep that burning process going in the skin. Cool it down with cool water. Do not pop the blisters. Remember, the skin protects the inside from the outside. If you pop a blister, you're letting germs through the skin, and you've got a whole other problem, because then you are subject to infection. So if the blister does pop, naturally, you can't do anything about it, but what you should do is you get some nice, sharp, clean scissors. Sanitize some little nail scissors, or if you have little medical scissors, clean the skin, clean it with alcohol or hydrogen peroxide, something that sanitizes the skin. Cut away those little flaps of dead skin, because each one of those little flaps of dead skin is going to be a little pocket where bacteria can grow and possibly cause infection. So cut those away without cutting away any of the healthy skin. Just get it as close as you can, cutting away the dead skin, and then coat that area with antibiotic cream. If you don't have that, petroleum jelly. It'll act as a barrier where the skin isn't. Cover that with a sterile non-stick gauze, because you've got this kind of a gooey wound, right? If you use some tissue or something like that, it's going to get all stuck in that wound, and again, more germs, place for germs, and it's going to hurt so much when you take it off. So non-stick sterile gauze, and then cover it with the gauze, and then either wrap some gauze around to protect the area and hold that non-stick sterile gauze in place, or tape it down if it's an area of the skin where you can tape that gauze down onto healthy skin. Use that tape on healthy skin. And of course, then you can take painkillers that you're not allergic to or that you can tolerate. Ibuprofen or Tylenol are perfect candidates. Third-degree burns. Now, third-degree burns, again, have gone all the way through that upper structure of the skin. first thing to do, stop the burning, just like before. Cool water, not ice. If you're in a situation the burn has some melted materials in it, like maybe some clothing or some plastic or something is melted into the burn, don't try to remove that. That's not your job. A doctor needs to do that. But if that's not the case, next thing you do, coat it with antibiotic cream or petroleum jelly. You need to, once you've cooled it off and you've cleaned it up, you need to create a skin where there is no skin. You need to create an antibiotic barrier that's going to keep the outside germs from getting inside the body. You've got a hole in your skin. You have to create a second skin with some antibiotic cream or petroleum jelly. Cover the area with a sterile non-stick gauze. Wrap some other gauze around it to keep it in place, or tape it to healthy skin so that that non-stick gauze can stay there and act as an additional barrier to germs. And then you change that dressing once per day. So you repeat that process once per day. Clean the area, cover it with antibiotic cream or petroleum jelly, put a sterile gauze on, and fix it in place. That's keeping it clean. Since you have a hole in your body, you also will need to get antibiotics from the doctor. Antibiotics, because there's a place in your body where the outside germs are getting to the inner structures of your body. You need those antibiotics to fight any infections from the inside of the body, because your skin isn't doing its job there. It can't keep you clean, so you need to be able to have some extra oomph to keep those germs away and keep from getting some other kind of deeper infection. And also, now, additionally to this, watch for infection. Okay, now infection would look like extra swelling, redness extending further beyond where the wound site is. Things could start changing color. Maybe pus is coming out. Those are all signs of infection. And again, take painkillers that you can tolerate. Ibuprofen or Tylenol are appropriate. If you have a 3rd-degree burn and you're managing it at home, you do need to get yourself to the doctor, because you need to have that doctor take a look and make sure that there's some really important structure underneath the skin is not damaged. And if it is, the doctor will know how to treat that. Also, the doctor has the sterile instruments to remove dead skin from a severely damaged area like that. The doctor will know how to assess if there's an infection that needs to be dealt with in some way. The doctor will also know if you need skin grafts. Of course, you're not going to be doing skin grafts at home, so the doctor can help you with that. Also, the doctor can prescribe the oral antibiotics that you need. So if you have a 3rd-degree burn, say you're camping, you've got that 3rd-degree burn, you already know how to manage it in the instructions I gave you before, but as soon as you can, get to a doctor for these other steps. So that's it for the 1st, 2nd, and 3rd-degree burns and how to deal with them. But we have a bonus coming up. I'll tell you about a couple of other different types of burns that you might encounter in your everyday life, and I'll tell you how to deal with them right after this.
If you're enjoying this video, I have a resource that I want to recommend to you. I 100% think it should be in every household. It's a book called Home Doctor. I purchased it myself with my own money and have enjoyed it for a while. And after using it and perusing it, I reached out to the company and asked if there was some way that I could bring this book to a wider audience, because I truly think it's that good of a resource. I think it should be in every home. So basically what it does is it gives you somewhat of a medical education about all kinds of home health issues and emergencies, so that you can quickly understand what the problem is and how to deal with it quickly and effectively.
the information is it's medical training distilled down for a lay audience, and I think it's fantastic. Home Doctor has 3 authors. Dr. Maybelle Neves, she's a well-respected surgeon and oncologist. Dr. Rodrigo Arturio, he's also a well-respected surgeon, but also was a primary care physician to a tribe deep in the Amazon jungle. So he's an expert at healing with limited supplies and using natural remedies. The 3rd author is Claude Davis. He's an historian and lifelong practitioner of folk medicine, and he has honed healthcare skills for when modern medical assistance is unavailable. If you purchase it from the link down in the description, you'll be taken directly to the Home Doctor website, where you can actually see photos inside the book of the kind of information that's available in it. Also, they have a full library of other kinds of wonderful home health resources, like how to build your own home or plant your own home remedy garden, and how to keep your own home herbal apothecary, and so many other things, like how to survive in wilderness situations, what to do when you're far from a hospital. In fact, a lot of the things that I'm teaching you in this video series are wilderness medicine techniques you'll use to keep yourself and your family healthy when you are far from medical care and you can't get to definitive care quickly. You are empowered to deal with those things, yourself. And that's what this book is too. I purchased it in a hard copy because I like to have a handy resource right there at my fingertips where I can just open it up and look directly at the information I need right away. But when you purchase a hard copy from the Home Doctor website, they also provide you with a digital copy. So you can also have that on your mobile devices like your phone or your computer, so you can look up whatever you want in your downtime, or even if you don't have the book with you and you need to know something quickly. It's a very affordable price. And if you buy from this link below, it is actually a cheaper option than if you purchase it somewhere else on the internet. Plus, I get a small commission for referring you to the product, so that really helps out the channel. I think you should check it out. I think you're going to love it. As promised, here we are with bonus burns, chemical and electrical burns. Lots of different household chemicals have the potential to burn your skin. Window cleaners, drain cleaners, toilet cleaners, laundry detergent, mold remover, oven cleaners, they all use very potent chemicals that are designed to cut through organic filth in your home. And since they're designed to dissolve organic matter, they will also dissolve the organic matter that is your skin with a long enough, prolonged enough exposure to the skin. So what should you do if you have one of these kinds of chemical burns? First thing you need to do is, if it's a dry chemical, brush it off. Brush off as much of it as you can. Okay? Because if you were to wash a big cake of dry chemical that's sitting on your skin, you could actually cause it to cover more area. Like, say you have a bunch of dry chemical on your arm. If you were to apply a lot of water to that, it could drip all over the rest of your body. So get as much of it off as you can. Then flush the area with a lot of water. Try to do so without spreading that chemical to other parts of your body. A hose is great for this because you can target where you're spraying, on your body. Flush it off. I mean, 20 minutes is not too long. Just flush and flush and flush and flush and flush with lots of water. Under a shower head is good. A bath, bad, because what are you doing? You're creating a bath of that chemical that you're trying to get rid of, and you're covering your whole body in it. No bath. You want to flush. Hose, shower head. If it's a small surface area like your hand under the tap of the sink, lots of water. Just flush like crazy. Go to the hospital immediately if that burn is in your nose or in your eyes. Yes, you can flush your eyes. Yes, you can flush your nose, but these are such sensitive areas that you're not going to have the resources to be able to treat those for burn at home properly. So go to the hospital if it's nose or eyes. But again, no matter what it is, brush as much of it off as you can, and then flush, flush, flush. And then in that case, assess, do you have a first degree burn, which is just, a surface, no skin broken? Second degree burn, is it blistered? Does it look like the skin is actually damaged and misshapen? Third degree burn, did it puncture right through to the other layers? Is there a hole in your body? Treat accordingly. Electrical burns. See a cute little child here doing the worst thing possible? Well, guess what? I did that once myself, and I don't even have the excuse of being a toddler. I was probably 12, and I was trying to get one cord unplugged from an extension cord or something. So I bit on the cord of one and yanked, and I definitely burned myself with an electrical burn. I had the side of my mouth was just all kind of gray because the electricity had burned my face. Ugh, stupid. So something I would do. But anyway, what do you do? Again, cool it off. Cool with a wet cloth on the area. Do not pop blisters. Pop quiz. Why don't we pop blisters? Bacteria can get in the folds of the skin. Gently clean the skin. And again, put a non-stick gauze bandage on the area that's been burned. One other thing you need to be in mind, though, about an electrical burn is that you also have to go to the doctor, even if it doesn't look that bad. For electrical burns, now we're not talking about lightning necessarily, but human-made electricity can, depending on the kind of burn that you get from that electricity, it could have damaged internal structures. Electrical burns are dangerous because they can cause heart attacks. They can cause all kinds, your brain is an electric vehicle up there. It can cause you to misfire. It can burn, organs or structures in the middle of your body. It really depends on how the burn happened. So it is a very, very good idea after an electrical burn to go to the doctor and see if you need to tend to that in some kind of other way. Well, that pretty much sums up our talk on burns. I hope you learned from some of my anecdotes what not to do so you can prevent burns. I also hope that I've sort of increased your toolbox of home health how-tos so that you can keep yourself and your family safe. Be ready so that you don't get burned by burns. Please comment below if you think that you feel empowered to try some of the treatments that I talked about in this video today. Also, let me know if you've heard of any folk remedies for treating burns, because I'd like to address if those are actually medically viable or not. Also, please leave a comment and let me know what else I can address on this channel that would be helpful for you. Thanks a lot. See you next week.